Hi everyone. Welcome to our April meeting of the Australian Sensitive Data Interest Group. This is an interest group that's co-facilitated by the ARDC and the Australian Data Archive, where we get together and talk about interesting and exciting things going on in the world of sensitive data. I'd like to start by acknowledging and celebrating the first Australians on whose traditional lands we're all meeting today in our various places around the country. For me, that's the Whadjuk Noongar people, and pay my respect to elders past, present and emerging. As we're now starting to do, let's start this interest group meeting with some news and announcements. Today, the news is mine. The institutional underpinnings program that I've been managing over the last year brings together a group of universities who are co-writing a research data management framework for research institutions, universities, and the consultation draft for that has now been released. There's an element there that deals specifically with sensitive data and the classification of sensitive data, and it would be fantastic if we could get some feedback from the group on that section. If anyone has any other news or announcements that they would like to share, well, you can pop something in the chat, but if you have anything that's coming up for future meetings, you can email it to us and we can include it in this section of the meeting. And with that, I think we'll get on to the main event for today. So we'll be hearing from Felicity Flack from PHRN on linked sensitive data, a beginner's guide. We have a collaborative note-taking document where you can take notes as you go. We are also recording this meeting and we'll link to the recording from that collaborative document once that is available. But yeah, there was a lot of interest in hearing about linked data in one of our previous meetings where we were talking about upcoming topics. We thought that a good place to start would be to hear from PHRN about, you know, what is the deal with sensitive, with linked data? How does it work? What can you do with it? Yeah, we thought Felicity would be a fantastic person to talk to us about that. So without any further ado, I might ask Felicity to share her screen.
Thank you, Nicola. It's lovely to be here. Let me just share my screen. Doing the right thing? Can everybody see that?
Got it.
Great. Got it. Excellent. So thank you. I should start by saying that I too am on the lands of the Whadjuk people of the Noongar Nation today. It's unusual for two of us to be in the same place, so that's lovely. And thank you to Nicola and also to the ARDC and ADA for inviting me to come and talk. When we discussed what I'd talk about, we thought that the best place to start would be at the beginning. So to be very clear, this is a very beginner's guide introduction starting from the basics. So if you are an experienced user of linked data, then you might have better things to do. But if this is something new to you, then this might be the right place to start. So let's get started. So first of all, just say I work for the Population Health Research Network, which is one of the other NCRIS capabilities. And what we do is link sensitive human data. So I should also be very clear from the introduction that I don't know anything about the sort of biodiversity world. So if you're interested in plants and animals, I am not your person. So what I'm going to cover today is a general introduction to what do we mean by data linkage, what types of data do we link in the PHRN, how do we do it, what exactly is the PHRN, And then I'll finish off with some sort of tips about how do you find the data that you might be interested in linking, and a general overview of what's the process for getting access to that linked data. So let's see how we go. So in very simple terms, linked data is just a method of bringing together information derived from different sources, but relating to the same individual or event into a single file. And when we think about human beings, many of our life experiences from the moment that we were born until the time of our death collect data about us. So information is always being collected about us when we are born, we start school, we could visit a hospital, we get married, we have a baby. Lots of data collected about us across our lifetime by different organisations. And the other thing that's important to think about is that these records about us, in our world, we like to think that those records can be divided into two parts. They contain information about our identity, and we think of identifiers as things like name, address, and date of birth, but they also contain the information about the service that we received. Or so it might be our diagnosis, or it might be our what school we were enrolled in, or what were our test scores, or all sorts of different types of, and we sometimes call that content information. So that's the sort of bulk of the record, and then there's identifiers with it. And so it's helpful to think about, you can divide a record into two parts. Okay. So to be clear, we are talking about identifiable data collections that meet the Privacy Act definition of sensitive data. So today I'm not going to be talking about open data. We're just talking about data that is sensitive and cannot just be provided in an open forum. So the kinds of data we're talking about require the interests of the research use of the data to be weighed against a range of other interests, including moral and human rights issues. And this means that the authorising environment for access to this data for research is complex, and it involves a web of legislative and ethical requirements. However, I'm not today going to dive down into the legal and ethical issues around accessing sensitive data, but I will be referring to some of the methods that we use to link and access linked data that are part of the response to these legal and ethical issues, because I think the legal and ethical issues are a much bigger discussion that we probably don't have time to get into today, although hopefully we'll have some time for some questions at the end, and if you've got some burning issues, I'm happy to tackle them if you like. So let's think about the types of data, and I've divided them into sort of 4 different types of data that are things that we can link. So the first, and probably the type of data that we mostly link, we call administrative data. And this is any data that is collected in the provision of a routine service. So things like in the health data sphere, hospital admissions, births, deaths, disease registries like cancer, the medical benefits scheme, pharmaceutical benefits scheme data. We link a lot of health data, and a lot of health researchers use the linked data that we link, but we also link other kinds of data, what you might call social or human service data. So things like education, housing, justice, child protection data, disability data, and other community welfare data. So that's what we call administrative data. It's generally collected across the entire population, and over long periods of time. The second type of data that we can link, I'm going to describe as clinical data, and that's the detailed clinical information collected by healthcare providers, and includes things like e-health records, pathology data, imaging data, sort of thing. The next type of data is what I've called here project-specific data or research data. And this is data often collected by researchers for specific research projects, or sometimes by government departments. They sometimes do surveys and things for particular reasons, but this is data collected for a specific project. It's not routinely collected data over many years, although. So the types of research data that we often link are things like longitudinal cohorts, and some of you might be familiar with some of the larger Australian cohort studies like 45 and up, the RAIN study, or the Australian longitudinal study on women's health. There are many more, and I'm sure you can think of some other examples. Clinical trials data, so people are recruited specifically into clinical trials, but then the clinical trials might be interested in long-term follow-up of those trial participants. And so you can link data on, for example, to see whether they went to hospital, 5 years after the trial ended, for example. I've mentioned surveys already. And of course, biobanks, you can also link biobank data to administrative data, and that can give you a much richer data to do research on, for example. And then something that we probably do less of, but I imagine in the future we'll be doing more of, is what I'm calling individual health and wellbeing data. So thinking about wearable tech, Fitbits, etc., and genomic and genetic information you can also link. So lots of types of data that you can link together to be able to use for really valuable research. The other thing that's important to think of, particularly in the Australian context, is, and this slide's a bit health focused perhaps, but it does reflect the Australian political system in that we're a federation, and particularly in our health system, different parts of government collect data about different parts of our healthcare. So your birth and death records are collected by the states and territories, as well as your hospital records and the disease registries like the cancer registries and the notifiable diseases registries. You're thinking about COVID, for example, whereas the Commonwealth collects MBS, PBS, aged care, veterans affairs, those sorts of things. So if we're wanting to understand things about the Australian population, across the lifespan, then we need to be able to link together these different collections collected by different organisations in different parts of the country. So it seems like a lot of data and a lot of effort to bring it all together. So why should we bother to do it? Well, linking this data together gives us much richer data sources, and it can be used for a wide range of different types of research, including things like investigating common and rare diseases and events, the real world evaluation of policies, services, and various interventions, whether they be health interventions or justice interventions or other sort of social service interventions, studying the origin, including the social origins of health and wellbeing, and also monitoring the health and wellbeing of Australians across the life course. So there are lots of different reasons you could use linked data. And the sorts of things that probably we are particularly interested in is using linked data for better health services, for new therapeutics, for healthy aging, to look at the social impacts on health, environmental impacts on health, and also prevention of emerging diseases, which we're all suddenly more aware of the last couple of years. So I thought I'd give you a couple of examples of the kinds of research that linked data can be used for. And this one's about prisoner health. There's a group in Victoria that do a lot of work with prisoners. And it's really interesting stuff. So the ability to link information from the justice system to the health system enables us to look at people released from prison and work out what that prison experience, what impact it can have on their health. So, and then the other example I thought I'd share with you today is more of an environmental one, which is about the Mr. Fluffy insulation. I don't know whether people are aware of this, but when asbestos was thought to be a miracle thing. It was used in a sort of dried, it was fluffy, insulation that used to get sprayed into people's homes, and it was particularly common in the ACT. This study looked at 17,000 people who had lived in Mr. Fluffy houses in Canberra and were able to link that to the National Cancer Database as well as death records and determine what the risks for these people were of cancer, particularly mesothelioma, when they compared it to people who hadn't lived in Mr. Fluffy houses. So there's all sorts of really important research that can be done when we're able to link data together. So throughout the presentation, I'll sort of stop and give you some things to follow up if you want to do further reading and find out more. You can look on our website there for some more impact stories and examples of how you can use linked data. And we also have a list of a searchable list of all the publications that have used the PHRN linked infrastructure that you can search through and look for topics that you might be interested in. So that's why we might want to link data. How do we link data? And as I mentioned before, the methods that we use to link data are very focused around minimizing risks to privacy. And one of the ways that we do that is what's sometimes called the separation principle. And the idea is that you keep the identifiers separate and away from the content data in the record. So there are 4 basic steps in the process that we use, and essentially we take identifiable data from the record. So we separate the record, take the identifiers, we run those identifiers from the different data sources through a computer program that compares those details and decides whether there's a match. And when there's a match found, we call that a link. So let's think about that a bit more. Not only do we separate the data, but we also separate the roles. So people have different roles, and if you're a data linker, you shouldn't have access to the content data, for example. So we have 3 main groups of people involved in the process. Firstly, the data custodians. So these are the people who are legally responsible for the data. That might be a formal role that sits in a government department, or you might be the researcher who has collected the data, in which case you're the data custodian of that data that you've collected. In our world, we have what specialist data linkage units, and sitting within those data linkage units, we have staff whose job is to link the data. They are data linkers. So they create and maintain these linkage keys or IDs. Cool. And then the linked data is used by data users or researchers for their analysis and research. So 3 groups of people. And this is kind of how it works. So in this example, we're going to look at 2 different data custodians. In this case, we've got a health department and the Registry of Births, Deaths and Marriages. And this is an example of a record, a hospital record and a death record. So the first step in the linkage process is to take a copy of the identifiers. So each data custodian takes a copy of these identifiers and they send them to the data linkage unit. The data linkage unit then looks at the 2 records, runs them through a computer program and decides whether they're a match, whether any citizen in the hospital record is the same person as any citizen in the death record. And in this case, the computer says yes, it is a match. And if there's a match, that linkage unit creates what we call a linkage ID, which is a unique person number. And over time, there's ongoing linkage. So a linkage unit would link the hospital records and the death records at least annually, actually mostly much more frequently than that. And they update those links constantly. So they're continually building essentially a catalogue of where the records about individuals are. They don't hold those records, they have no access to the content in those records, but they know that any citizen has a hospital record and a death record. Then if a researcher wants to do a research project that involves linking hospital records to death records, they apply to the linkage unit for access to a particular cohort for their particular study. And then what the linkage unit does, if they determine that any citizen is part of that cohort for that particular research study, they create what we call a project linkage ID, so a specific person number for any citizen for that research project. And that project linkage ID is just created for that project and therefore cannot be used to link data from different projects about any citizen. When the linkage unit has created that project linkage ID, they then send that with the individual record ID for each record that should be in the researcher's cohort back to the data custodians, who then separate the data again. This time they replace the identifiers with that project ID, and then they send that data to the researchers who are able to merge the data based on that project ID and conduct their research without having the identifiers for the individual people in their research cohort. The access to that data can be provided in a range of ways depending on what data collections have been linked and what the data custodians are happy and comfortable with, and the sort of risk level determined for that particular sensitive data. So sometimes that data is provided directly to the researchers to use at their university. Sometimes that data is only provided at the, say, health department's secure access environment. So the researchers have to come into, remotely, into the health department's secure access environment. And sometimes the data is provided in other secure research environments, such as the secure research, unified research environment that the PHRN has developed over many years. Okay, so I didn't talk a lot about exactly how that linkage is done, and there are a range of different ways you can link data. The one that we don't see very much anymore is manual linking, which is the old-fashioned way when people would physically get files or paper files or records and look at them and say, do I think that any citizen in this file is the same as any citizen in that? That's very labor intensive and we don't really see happening anymore. The most common in specialist linkage units is some form of probabilistic linkage, where an algorithm is used to determine the probability that one record is about the same person as another record. And that's often based on a range of different variables. So name, address, date of birth, sex, and sometimes additional variables if they're available, which gives what we describe as gold standard or the highest quality linkage. The next option is deterministic linkage, and this is when you link records based on an exact agreement. So say you're linking on name, it has to be any citizen spelt exactly the same. It can't be, you know, any citizen with an I and no E. That wouldn't be a match, for example. And the quality depends on the quality of your matching variables. And then the fourth kind of linkage, which is actually a whole group of different linkage methods, but can be categorized as blindfolded linkage, are a range of different methods where your match variables are made non-identifiable by hashing, encryption, or Bloom filters. And this is sometimes used when, for various reasons, you can't get access to identifiers for your linkage. So there, you can read up on those if you want to know more. So I touched on this earlier. In Australia, you might want to just do a project in a single state or just with Commonwealth data, and that's what we would call single jurisdiction linkage. But because we live in a federation, we often want access to data from multiple jurisdictions. And this is what we call multi or cross-jurisdictional linked data. And it's important in Australia because our population is mobile. There's significant movement of people across borders and people use services across borders. If you think particularly of highly populated borders, for example, the New South Wales-Queensland border, people are moving across all the time and using different services. In Australia, we don't have in any area a single national data collection that could cover all of the possible research projects that people might be interested in. And sometimes we need large numbers for research. And in case, if you're looking at, rare events or rare diseases, you might actually need the whole Australian population in which case we need to link together or get access to data from multiple jurisdictions. The other thing to take into consideration is that in Australia, we don't have an enduring personal identifier that can be used across lots of data collections. And there are limitations in our Privacy Act about using unique identifiers, such as the Medicare number, for doing things like this. So that probabilistic linkage, where you use multiple variables, works well in the Australian context. So now I thought I'd tell you a little bit more about the PHRN. And we're a national network of these specialist data linkage units, as well as some other services, such as we fund secure data laboratories and some other e-research services and that support researchers to access linked population data across Australia. Here you can see a little map. So there is a jurisdictional linkage unit that services each state and territory. SNT Data Link links data for both South Australia and Northern Territory, and Cheryl in New South Wales links the data for New South Wales and the ACT because the territories are a little bit small to have their own linkage unit. But every other jurisdiction, including the Commonwealth, so the AHW is the Commonwealth linker there. We also fund the Secure Unified Research Environment at the Sachs Institute in Sydney. And we have the National Coordinating Office, Program Office in Perth, which is where I work. And we run the National Online Application System, which is a central online application system for researchers to apply for access to linked data from multiple jurisdictions. And you can see all the different organisations involved there. I don't know how easy this picture will be for you to see, but it's trying to give you an idea about how we coordinate this linkage nationally. So if you look at the outer ring, that's the sort of data ring, and there's different types of data that's collected out there in each jurisdiction, including administrative data, clinical data, and research data, which all can be linked at the jurisdictional level. So each state can link that data together for a state. That then all can be linked around that second layer, the sort of yellow layer, I suppose, for a cross-jurisdictional linkage, so that we can do linkages where we can follow people who have received services in multiple jurisdictions. When the data's been linked, that can be provided in secure environments, and then right in the middle where it should be is where the research happens and the research outputs occur. So we like to see lots of presentations. So the PHRN is been around for a long time now. We started in 2009. We link data from all Australian jurisdictions. I probably need to update this a bit, but essentially we've helped a lot of researchers over our time, over 2,500 applications for data since 2010. We've got over 1,600 peer-reviewed publications as well, and we've had more than 18 billion linked records accessed. If you'd like to know a little bit more about the PHRN, there's certainly more information on our website, and there's 2 publications there which go into a bit more depth about the PHRN itself. Yeah. So, okay, this all sounds very exciting, and there's obviously lots of data out there that you can access to link, but how do you get your hands on it? Well, the first thing is finding out what data is available to be linked. And I haven't gone into it in a lot of detail, but there are two different types of linkages that we do. So there are data collections that we routinely link, and we update those links, you know, anywhere. Sometimes it's weekly and sometimes it's annually, but depending on the data collection. And they are the collections that we describe as creating our master linkage maps. And there's a jurisdictional master linkage map in each jurisdiction. And those sorts of data collections are things like hospital admissions, births, deaths, emergency department attendances, are generally the sort of enduring linkages. And then we can also do what we would call an ad hoc linkage. So if you've collected some data, you can bring that to us and we can link that to some of these enduring linked whole of population administrative data sets. But in order for you to find out what data you could link to or would like access to or link together, a good place to start is on our website. So you can go to the PHRN website, and we have a list of the routinely linked data collections by each jurisdiction, and you can go in there and search. You can find descriptions of the data collections and the date ranges that they're available and who has them and those sorts of things. If you're just interested in a specific jurisdiction, then the best place to start is to contact or go to the website of the linkage unit for that specific jurisdiction. And you'll see all of the links for them there. And the sort of information that you'll find, so this is from New South Wales, from Cheryl, is lists of the major data collections. And then if you click on them, you'll get more information and access to data dictionaries and variable lists about the more detailed information about those data collections. If you're interested in cross-jurisdictional linked data, then again, best to start your journey on the PHRN website, and you can search around all of the different jurisdictions for what's routinely available. And you can also find comparisons of the date ranges that the data collections are available. So this one shows the public hospital admitted patient data, and you can see down the left-hand side the different jurisdictions, and you can see, for example, that WA has data back to about 1980, but everybody else is sort of in the 2000, 2005-ish mark. So if you want to involve everybody, you can't go back to 1980. So we've already alluded to the fact that this is not open data, that you do have to think about the issues of particularly privacy in accessing this data. So the access and approval processes are actually quite complex. For a single jurisdiction, and it varies a little bit by jurisdiction, but essentially the basic steps are: you have to submit a formal data application, and you submit that to the jurisdictional data linkage unit. It is then reviewed by what we call the client services team. And when they've reviewed it and they see that as feasible, like it's a project that technically we could deliver the linkage for, they then will pass that on to the appropriate data custodians for their approval and tell you that it's ready to go for ethics approval. So you always need two approvals. You need the data custodians to approve your project, and you need the ethics, at least one ethics committee to approve your project. And once you've got all the approvals through, the linkage unit will conduct the linkage for your project, and then the data custodians will provide access to the linked data in an approved location. If you want access to cross-jurisdictional data, it gets a little bit more complicated, but we are trying our best to streamline that process and make it as easy as possible. But in this case, you submit In the first instance, an expression of interest through the PHRN online application system. And then we coordinate review by all of the client services teams that would be involved in your project. So if you're asking for data from 3 jurisdictions, for example, we will organise for a meeting of all of those jurisdictions to review your application and then provide consolidated feedback to you about the feasibility of the project. When we've determined that the project's feasible, we say that your EOI is complete and it becomes an actual application. It's sent for data custodian review. You can then seek ethics approval. You'll get a final approval, and then the linkage occurs and the access to the linked data can be provided in wherever the approved location is. You can find more information about the application and approval processes at these links, and there's also a nice little YouTube video there that you might find of interest. And I'm going to stop there. There's lots more information you can find on our website. If you're interested in our Twitter feed, and I think I'll probably leave it there and happy to answer any questions. And we're back.
Awesome. Thank you, Felicity. And yeah, if people could put any questions in the chat, then we'll feed them through to Felicity. I actually have one of my own to start. So obviously an important part of this process is making sure that the identifiable information is separate from the content information. And I can see how that could be a challenge when someone provides you with a data set they've collected themselves, where obviously there is a connection between the content and the identifiers on the researcher side. How is protection of privacy managed in those instances?
So it does depend on how the data has been collected by the researcher. So if that data has been collected with consent, and each of those research participants has been told exactly what's going to happen to the data and that it's going to be linked and that the researchers clearly know who they are, there's no problem with that linkage occurring. However, that's not always the case. And often researchers have collected data some years ago and they didn't think at the time that they wanted to link the data, in which case that becomes a trickier, although not theoretically impossible scenario, in which case then we would be looking to set up separation of roles within the research team itself, so that it was very clear that there were only, a person or certain people within the research team that just had access to the identifiers, had no access to anything else. So you'd get sort of layers of separation involved there. Or sometimes you can get a sort of third party involved where you can get them to deal with the identifiers. So there are ways to deal with it.
Awesome, thank you. Kristen?
Yeah, so obviously PHRN has been established with a very much a health focus. It's right there in the H in the acronym. But
I'm sad about that.
But I mean, in one of the examples both examples you gave there, you're talking about data that would be collected by agencies that aren't health agencies. I think for the group, it might be interesting to hear what maybe a little bit more of the other kinds of non-health data that PHRN has worked with or has assisted researchers with. And then maybe you said at the start that ecology data, for example, isn't your thing. Are you able to give any kind of advice, at least starting points for people who might have interest in that area?
Okay. Let's start with the sort of non-health data that we are familiar with. So there's certainly over the years, there's been quite a lot of research done with education early childhood development data. Things like the Australian Early Development Census is frequently linked and linked by all of the data linkage units in the country. Actually, those sort of routine linkages. So yeah, so education. Child protection is another one that there's several research groups around the country that have for many years done a lot of work with child protection data. Justice and policing data. So people interested in, so I mentioned the sort of prisoner one, but there's also been research looking at, you can look at sort of child development and justice outcomes and education and justice policing data, those sorts of things. What else? There are environmental data and there are a number of projects where various types of environmental data have been linked. For example, I'm thinking sun exposure data, I talked about asbestos, climate data, so heat, those sorts of things can be built into linked data projects. They often do also have a health component to them. People are interested in sort of environmental human impacts. So it's the sort of not just humans' impact on the environment, but the environment's impact on humans is where that comes up. I don't know that I have a lot to say about ecology, to be honest. Really not my thing. But I suppose lessons learned would be when you're thinking through these issues, you have to understand the authorising environment that you're working through. You need to understand the legislation very carefully. You need to know what world you're working in that context. Not just legislation, but also the policy environments that you're working in. And when you're working across jurisdictions, you need to have some understanding of the variation across jurisdictions. In the health world and the privacy world, even though there are variations, for example, Privacy Acts there are variations, but they are actually very similar across the jurisdictions. So it's not really a significant barrier in that sense. And the exceptions are often similar. I mean, the word, you know, some Privacy Acts, it's medical research and some it's health research, but you know, if you take a broad perspective on it, it's all right. But as far as if you're thinking about humans, one of the issues in the Privacy Acts is that the exceptions for research often are medical or health. And if you're wanting to do research with waivers of consent that are not in the areas of that could not be attached to medicine or health, then I think you run into some privacy problems.
We've got another one. Steve, I see your hand up, but we had one come in just before from someone in the chat who said, presumably linked records will often contain enough information to enable re-identification if correlated with publicly available records like the electoral roll. Are there protections against re-identification?
Yes, so obviously just removing identifiers is not necessarily, I mean, it's a good thing to do, but it's not in itself always going to be sufficient to minimize risk. So there's a range of things that happen. Firstly, researchers are all required to sign data sharing agreements or confidentiality agreements where they sign away their lives and say they will not re-identify data. And then the data custodians will specify where they're happy for that data to be placed and exactly who they're happy to access that data. So you can only access the data if you are named on the data sharing agreement and in the ethics application. And they often will say you can only have access to this data in this secure remote environment, and there are a range of them. in the country now. So for example, if you're accessing Victorian health data, you can only access that in what they call their vault, which is their secure research environment, or if it's involves Commonwealth data, then it might need to be in the secure unified research environment at the SACS, or possibly in the newer environment that they're developing at the AHW called the SHRAE, or it might be in a university environment that the data custodians are happy with, something like the SERP at Monash or Erica at UNSW. So there are sort of layers of security that sit around this data, and to try and minimize the risks of not just re-identification, but that because just re-identification in itself, if nobody does anything with that information, then sort of no harm is done, but to stop people from harming others through using re-identified data.
Cool, thank you. So I see another question in the chat, but first, Steve, you had your hand up. Would you like to ask a question?
Yeah, I was just thinking you were commenting on, in a sense, some of the privacy and other, you know, the exemptions, and you know, particularly for medical health research. Given the passing of the Data Act this week or last week, whenever it was, I presume that I mean, it doesn't exclude that, but it provides another avenue for now for dealing with what might previously be limited, to some of those exemptions. And any comments on where that's likely to head, I guess, would be.
Well, I am currently in the process of ploughing through the new Act in detail. But one of the first things I noted was that the Privacy Act does not go away. So you have to adhere to both the Privacy Act and the new DAT. So I'm not sure it's going to change that much, to be honest, in that regard.
Thanks. So then from the chat, could you outline the costs involved in the data linkage process?
Yes, there are costs involved. Mostly, well, it's cost recovery. It's not full cost recovery, and it depends on who's providing the data and who's doing the linkage and how complicated the linkage is. So rule of thumb, the more data collections you link and the more people, the more records, or greater the number of records involved, and the greater the number of jurisdictions, the more expensive it gets. And each jurisdiction has a different costing model. So the costs are different depending on which linkage unit you go to. So I can't give you it'll cost you this for 10,000 records. All of them will provide you with a cost estimate up front. So that's my recommendation. If you've got an idea, go and talk to them about it. Or if it's a cross-jurisdictional one, you can put in just a request for quote through our online application system, and we will get back to you within 2 weeks with a cost estimate. The service that we provide is essentially a bespoke data service. We put together for you a bespoke data collection, and everybody's request is different. This is not an off-the-rack service. So it takes us, particularly for cross-jurisdictional projects, some time to work out exactly how we would link all that data together, and how much data you really need for people to put a cost estimate together for you. So yeah, don't come the day before, plan ahead.
Well, I have one last sneaky question before we wrap up. We've talked a lot about government data. Could I come to you if I've got a project where I have data that could come from 2 private sources? Maybe I have a private clinician, and for some reason Facebook have said that they will, give me their Australian data, and I want to know something about the connection between those 2 things. Are there services in the network or other services who would be the sort of the separated third-party linkage unit?
So, so theoretically, yes, you can come to us with 2 data collections that we've never linked before and ask us to link them together for you. You still would have to go through the same, we'd have to have approval from those 2 data custodians, and also there would need to be ethics approval for us to do that for you. But yes, we could be a third-party linker for you. And I suppose just worth, in reference to thoughts about private sector data, just to note that particularly if you want to, either the private sector wants to access some of the routine link data that we link, or would like to link something they'd collected to it, the bottom line is it has to be determined to be in the public interest, unless there is explicit consent from all of the people involved.
Awesome. Thank you. That helps me. Kristen?
Oh, you saw me unmute.
Yeah.
I saw that we were coming up close to time, so I thought I might do assist with a little segue and additional spruik for PHRN, if that's okay.
Ah, yes.
Just to comment to the group that we got all the feedback over previous meetings that we've had around what kind of interest in sensitive data topics you had, and data linkage is one that popped out time and again. After some discussion, we went, well, we're not really the experts in this, and our partners over at PHRN are the experts in this. So if it wasn't already apparent, ARDC is an NCRIS organisation, PHRN is another NCRIS organisation. So we really saw our role here as connecting all of you, so people like Felicity Leslie to people like Felicity Flack, to say, well, actually, if you need help with data linkage, these are the guys who you should be speaking to. So I think we decided that it probably wasn't necessarily the most appropriate use of everyone's time for ARDC to try and deliver a set of information sessions or talks on this, but PHRN already have a lot of engagement and outreach in this area that I think we're intending to promote via this group, so that you're all aware of when these events are upcoming. But Felicity, did you have any, can you give people an indication of those kind of events?
Sure. So I'll say stuff that's already available. We have a YouTube channel, and there's a whole range of videos on there, from presentations from researchers who've used linked data through to, we did a series for clinical trialists around how to access and plan studies, and that's quite useful. And then we have a series of ongoing webinars that we call the Linkage Luminaries. So we get some of the best researchers in the country who've used linked data to talk about their work. So that happens approximately monthly, usually at a lunchtime. And we also are in the midst of developing some introductory sort of learning materials, a little bit along the lines of what I've talked to you today, which hopefully will come available in the not too distant future as well. So yeah, keep an eye on our website. You can subscribe to our newsletter, look at our Twitter feed, these if you want to keep up with what's happening.
Awesome.
And feel free to just email us and ask a question. Happy to help you out.
Great, thanks Felicity. And yeah, we'll be highlighting, if you've got webinars coming up, we'll be highlighting them in these meetings and sharing with the group via our newsletter as well. But yeah, that's we've hit the hour, so thank you so much, Felicity. That was really helped me to understand a lot. I think it was quite useful for the group as well, looking at the chat. And thanks everyone for coming along. Thanks for all your questions.
Thank you, it was a pleasure.